the question everyone is dying to know the answer to. Let me break down how you can use Botox to help improve the appearance of the lower face. All right, so let's define jowling. So I think most people kind of know jowling is that excess volume that kind of hangs at the side of your mouth. Now, typically jowling is mostly caused by volume loss in the mid face. Everything starts to kind of separate and fall forwards as we get older, but there is some muscle pull that happens in the lower face that can emphasize jowling and make it worse. And I know what you're thinking, wait a second, Montana, Botox or neuromodulators are used on the upper face. Well, yes, they are. That is their on-label injection sites, but there are actually some target muscle groups that we do inject with tox in the low face. Okay, so let's talk about prime suspect number one, the DAO muscle, which connects from the corner of the mouth and pulls down like this. You can see that emphasis downwards is only going to make jowling worse if you have that constant tension on the low face, also called resting bitch face. So relaxing that muscle on somebody whose mouth who really turns down at the sides can really help with the appearance of jowling. Okay, and suspect number two, the mentalis muscle, the chin, which also can help emphasize the pull down there. It kind of works as an accessory muscle. And suspect number three, this is a big one, the platysma on the neck. So if I go, do you see that cord-like structure that pulls outwards? That will pull everything in your low face down. So again, it can worsen everything. It can emphasize that pull down on the low face, making jowling worse, making the jawline look less sharp and defined, and really just taking away the structure depending on how strong you are. So you can inject into the platysma themselves, the bands, hit those cords, or you can also do a Nefertiti lift on the jawline here, injecting just under the jaw to, again, weaken the platysma so it can relax inwards and tighten up your jaw. Now, Botox is not going to be a replacement for filler. When you think of filler, think of volume, shaping, contouring, defining. If somebody really has true jowls, they're probably going to need their cheeks done, some lateral support, their jawline filled. But I always suggest trying a little bit of Botox first because it's generally a little more cost effective. I consider it to be low risk, and it's easy to see if that makes the difference before you jump in to getting fillers done. A lot of people try Botox first. Hope that helps, and let me know what you guys want me to answer next.